In this brief video, we will review the operation and components of the HeartWare system as it pertains to survival flight during patient transport. We will use the standard HeartWare competency checklist as a guide for instruction. As we have already discussed in the HeartMate video how to access the internal VAD webpage and how to contact the VAD coordinator on call, we will not cover this here. The most important component exchanges for survival flight during transport involve batteries and controllers, so we will concentrate on that exclusively. The HeartWare system is comprised of the pump connected to its brain or controller via a drive line that exits percutaneously through the skin. The system is powered by batteries, AC wall power, or DC automobile power. The surgical technique that assists in faster patient recovery is its intrapericardial placement, avoiding the need for an abdominal or preperitoneal pocket. This device is cored directly into the left ventricle, and its impeller provides more flow at lower pump speeds. Here is a brief description of system components. The reference for the vast majority of these photos and tables is in the HeartWare Patient Manual, which is located on the HeartWare website as well as in the Clinical Education folder in the shared drive. A basic understanding of these components, including identification and how they work together within the system, is all that is required. The controller is the brain of the system. It has 4 connection ports as shown for power and communication to the pump itself. It has displays for alarms, power to the pump, and indications of pump function. The controller display shows blood flow from the pump in liters per minute, power in watts, and impeller revolutions per minute. It is important to understand that these patients will be preload dependent and afterload sensitive. For example, when a patient experiences hypertension, pump flow will drop. Here is a closer look at the power connection and the driveline connection. To connect the battery to the controller, align the arrow on the cord with the dot above the connection port. In addition to battery life indication on the controller, each individual battery has an indication as well. Each fully charged battery provides approximately 4 to 6 hours of use for normal activities. This table shows battery capacity for each corresponding indication on the controller and the individual battery. The driveline connection into the controller should have a rubber cover or sheath over it for protection. When changing the controller, pull the cover back to expose the driveline connection. Each corresponding connection point on the controller as well as the driveline should have a red dot to help with plug alignment into the port. Additional controller buttons include the alarm mute and scroll buttons. Alarm conditions are classified as high, medium, or low priority. Each of these alarms has a unique sound, visual display, and a message. When an alarm occurs, 2 lines of text appear in the controller display. The first line tells you what the alarm is, and the second line tells you what to do. When an alarm is resolved, there is no longer an alarm sound or a light displayed in the alarm indicator. A high alarm is the loudest alarm. The alarm indicator on the controller is flashing red, and the text message demands immediate action for pump stoppage, controller failure, or limited power to run the pump. All high alarms will display a message on the controller display, and the alarm indicator will flash red. The VAD will stop if the driveline is disconnected or if the controller fails. For a VAD stopped alarm, the text message will tell you whether to connect the driveline or change the controller, as both of these situations may trigger this alarm. The only way to clear this alarm is to clear the alarming condition. The medium alarm starts at a low volume and gets louder over the next minute, unless the alarm mute button is pressed. A medium alarm is indicated by a flashing yellow alarm indicator, and the text message tells you to call medical personnel. A low alarm is indicated by a solid yellow alarm indicator. This message tells you to replace a low battery or reconnect to a power source.
Survival Flight Clinical Guideline Charlie 2 Cardiac Assist Devices contains troubleshooting guidance based upon VAD performance and patient response. Additionally, take a look at this chart from the University of Maryland that shows how hemodynamic changes affect pump performance, specifically power and flow. You are invited to compare the information in this chart with our current Survival Flight Clinical Guideline. That's all. Thank you.